post-graduation in Rajaya Muthiah Medical College and Hospital, and his added qualification is in PG Diploma in Health Science and in Diabetology, Annamalai University, Chidambaram. And today, sir is going to just make an overview of the topic artificial intelligence in the medical field, so that a doctor's point of view in an artificial intelligence. And our estimated speaker, Dr. Sendil Kumar sir, is a renowned expert in his field, will share their vast knowledge and experience. So they have dedicated their career to pushing the boundaries of medical innovation. Sir, over to you, sir.
Yeah, thank you, Gracie. And I'm not an expert in this artificial intelligence field. I'm just going to give sensitization. As Vishal told, almost the same points, just a little bit sensitization, because we're all yet to learn about AI. So I think that the second speaker may be dealing with how to deal with the AI tools, all those things. So just a sensitization. And I have been given only up to 6:45, so I will rush up. Yeah, impact of artificial intelligence. Yeah, it is a dawn of a new era. As Vishal was telling, it may replace all those things. Yeah, first, what is artificial intelligence? As the name suggests, it is going to be artificial, not humans. It is ability of machine or computer to imitate human behavior deals with the tasks that require human intelligence. Just so we are making the machine or AI tool, for that matter, any AI tool or AI kit that will be fed with the inputs in the form of information or data, whatever it is, and that will be made all this ability to learn, visual perception, face recognition. So it's not just like a computer. We are feeding the computer with human, whatever human is going to do, all those things will be fed with this network, like visual perception, face recognition, speech recognition, decision making, very important, and combination of this. So all those things will be made by a processor, and that will be converted into a AI tool, and that AI tool will be incorporated into the device, which can be used as a AI tool. Commonly we tell tool, AI tool, or AI kit, or AI smart device, whatever it is. So artificial intelligence is incorporating our human behavior and human intelligence into a device. All this we already know. Robotic surgery is not, as of now in India, will not be that much including into Google Maps. We already know it is also a form of AI. And driver-free car drive. For example, driver-free car drive. Yeah, they have to create all the collect the information, and that will be made into a tool, and the tool will be used so that it will correctly tell where to go right, where to go left, all those things. All these are some types of AI, artificial intelligence. The same thing given in the diagram format, especially social media. We all know, I think as of now, around even more than 120 to 160 AI tools are there. And without our knowledge, we are using them directly or indirectly. Yeah, AI is a simulation of human intelligence, as I was mentioning, processes by computer systems, little bit advanced of the computer, and advancements in AI brings groundbreaking technological advancement in medical fields, which we shall summarize actually. Yeah, it is going to be a revolution in the upcoming medical field. Simple. For example, a diagnosis which you may find difficult, already we are feeding the data into the AI system, and that AI system will rapidly work on it and find out what diagnosis it could be. Though human diagnosis is going to be the pioneer, this will help the clinician. So I want to convey this message. I don't think AI can completely replace our humans. It is going to aid the humans. That's what we have to carefully balance and use these AI aids. Yeah, all these are subsets of artificial intelligence, like machine learning, supervised learning, unsupervised learning, neural network, deep learning. Yeah, this diagram will be clear. So all this comes under artificial intelligence. Initially machine learning. So the data which you want to feed, that will be entered into the machine, like inputs or algorithm, we call that. The algorithm will be created. For example, if I want to diagnose a Kawasaki disease, example I am telling, which is a very, very rare disease. Clinically, I can't see for every patient. I can't suspect that he's having a Kawasaki disease, and I can't evaluate for Kawasaki disease, which is a rare disorder. But diabetes, hypertension, I can do fasting, postprandial HbA1c, polyuria, polyphagia, 50% will have the symptoms. All those things we are well aware. But for a very rare disorder, for any rare genetic disorder, it is very difficult. So what they do, a tool will be created, like AI tool. What they do, they collect all the cases of a very rare disease or any genetic disorder like Kawasaki disease, and they put that all the Kawasaki disease cases and create a software or create AI tool. And that AI tool will be brought into the market, and those AI tool will be used, that machine will be learned That is called a machine learning. That AI tool will be used, and it will be used as a sensor for the patients whom I see. So it is just takes a fraction of a second. The time taken for it may be used to create that, but the time taken once it is coming into the market. For example, the AI tool for Kawasaki, one example. This is that's to scan the patient. It will immediately give whether he is going to have Kawasaki disease or not. It is finished. So here it is helping the doctor to find out the genetic disorder or any Kawasaki rare disease. One example I am giving. So this is machine learning, and that machine learning can be divided into supervised learning, unsupervised learning, reinforcement. Supervised learning is the past data will be feeding, like now what example I told, that is supervised learning, which comes under machine learning. Unsupervised learning is I'm going to collect the data, and the data will be processed as the future. That is called clustering of data. And reinforcement is a similar type of unsupervised, but it is semi-supervision. So due to lack of time, I don't want to go in much detail, because I think next speaker will be explaining about how to create a AI tool, AI kit, all those things. My job is just to sensitize. Yeah, after machine learning, within that we have a deep learning. So to analyze the software which has been created. So machine learning is gathering all the data. That is called machine learning. And the machine is incorporated with algorithm. The algorithm is either neural network or all the data which the creator is going to give. Within the machine learning, we have deep learning, where subsets, where we have to analyze the deep learning and deep science. So all those things are components of artificial intelligence. Yeah, reasoning is also there, problem solving is also there, but all this will be created in the form of algorithm. That algorithm word is important. Yeah, generalized learning, reasoning, problem solving. Again, this is also important diagram which I explained. So image, for example, we are feeding the AI tool with all the images. For example, any particular carcinoma, cancer, where this images means this cancer is already proved. If I example I tell, I will give the input in form of all the images, which will be made into a network. For example, all the vision images. So this is called convolutional neural network. Convolutional means where I uses images. This is revolutionary. So neural network is all the data which is being fed in the form of neural circuit, which will be done by the app creator, AI creator. For example, as I told, all the images are fed. And what I do, once I want the patient to use this AI aid, and if he's getting that image positive for the image which I have already fixed into the tool, then he will be positive for CA pancreas or colon cancer for that matter, anything. So all this will be created, and it is ready-madely available. I already explained about supervised learning, unsupervised learning. So this is the example, machine learning. Machine learning can be divided into statistical learning, where statistics are being incorporated. Deep learning is another level of machine learning. And under deep learning only, we are having neural network. Convolutional neural network means all the images will be fed into it. And based upon the images, the diagnosis can be made. Still, clinician interpretation is very important. Yeah, again, same thing, components of AI technology. It is full of algorithm and facts, database simply. So database are incorporated into this, and the algorithm training will be given for the AI tool. All these things will be done by the particular fellow. He may be a medical or non-medical. Then the AI aid, whether it is a smartphone or it is a smart device or any kit format or any sensor device, and that will perform the task based upon the inputs or database or algorithm or neural network which is given. And the task performance will be whatever is being created. Yeah, this is also, we can say input is being given. For example, here the output is this AI tool should find out whether it is malignant tumor or non-malignant tumor. Simple. So accordingly, they will feed the data here. For example, this is CNN, convolutional neural network. Why convolutional neural network? Here they are feeding the images. So already known images all will be fed by the creator, like pathological images of any specific tumor, or in general tumor or non-tumor. We have the different histological appearance. Tumor histology will be different, non-tumor histology will be different. So all those things will be fed, and image formation is made in pixel formation. Future extraction is there. So all this neural networking is being done, and then it is coming ready-made. So based upon the creation, if he is going to have tumor, that particular image will be sensed. If he is not having any tumor or benign tumor, that particular image will be sensed. Maybe even color coding will be there, blue, red. So accordingly, we can interrupt whether the particular patient is having any benign tumor or malignant tumor. One example I am telling. So all this comes under deep learning technique. Yeah, neural network will function like the human brain neurons, and it will teach the computers to process the data like human brain. Again, same, select the data, computers learns and processes the data, and we have to extract the information. Neural network should be created, and again it can learn and relearn from the successes and prediction. So this is an example for database, how the database is created. Yeah, the emergence of AI in healthcare has recently been revolutionized. Some are even thinking like without doctors, with AI kit, the people can diagnose the patients with that is suffering from this disease. It's not like that. As far as I think, it's not so much going to be advanced. Definitely, a clinician intervention is must. AI can help the clinician; it cannot replace clinician. That's what I want to mention. AI systems are also applied in the healthcare sensor to enhance patient experience, patient care. It can support the physicians through the use of AI assistants like AI kit or AI tool or AI smart device or AI sensor, whatever it is. Yeah, it can improve the performance and ability of the diagnostic platforms. Very important. It can reduce the workload on the doctors. It can reduce the time taken by the doctors. For example, a rare disease, I can't keep on checking every patient if I suspect a rare disease. For that, I can use this AI tool, whichever is available for that specific system. So like that, it can be done. Yeah, biomedical experiments can be facilitated. Clinical trials, I will come upon that. Before this AI is long present, but now the advance is so much that we are all speaking about AI, and we are keeping the webinars, webex on AI. So in case if AI is not, I already told AI is nothing, just giving the inputs, all the data is collected, and then creating a neural network, and then putting the output. So for clinical trials also, we have always 4 phases: phase 1, phase 2, phase 3, phase 4. And for a drug to come to market, usually the initial drug, a new molecule, if it has to come to market, it will take 10 to 12 years to process all this. For initially animal experiment, then they will be done in human experiment, not the directly risky to the humans, like that. Phase 1, phase 2, phase 3, all the pharmacovigilance, pharmacodynamics, all those things will be involved. But maybe after this AI, that AI will be fed already with all the data that will be created by the data creator, and it will be easy. It's not that immediately AI will tell that this drug is good, this drug is this molecule, like that, but it will be aiding the trial runners for the drug. So that will be soon coming. Like AI will also help in drug surveillance and drug release to the market, new drug release or clinical trials. AI will be helping as soon. Yeah, all those things. For any procedure also AI can help, as I mentioned. Yeah, here the doctor is conveying the neural network which is created by AI, or it is a communication between the doctor and the not patient. Here it is a communication between the doctor and the AI tool. So some information is getting with the help of artificial intelligence. But the artificial intelligence is already fed with the neural network by the creator, who can be medico or non-medico. Yeah, this is the convolutional neural network. It can be images or whatever data is being incorporated into the AI. Yeah, as I mentioned, Kawasaki disease, you can see here. So all the, for example, a Kawasaki disease means a tongue will have this characteristic feature, a system will have this characteristic feature. All these pictures will be loaded into the AI kit, which have the neural network, and that I will match that sensor tool with whether the patient which I am examining is matching with him or not. If it is matching, then I will come to a conclusion that he is suffering from Kawasaki disease. If it is not matching, he is not suffering from Kawasaki. One example I am telling. And it is highly efficient. That's what the trend in AI now it is. That is, whatever AI kit is being created, it is very highly efficient, highly productive. Yeah, still ours remains like medical history taking is always important. Physical examination is there, lab results, then imaging. In fact, all these can also be created into AI tool. For example, if this history, if you ask the patient that history, that will be recorded by the AI tool, and already the AI tool has the history. So it's simple. I am pre-feeding all the data into the AI kit, and the patient who is going to communicate with the AI kit is going to give the data, and it is going to match. So before, after, like that we can remember. Again, there are sensing using the neural network which is already being created, and they are matching, like I told for Kawasaki disease. Yeah, same way you can use it for diagnosis of colorectal cancer, as Vishal was telling in the beginning. for carcinoma, for lung cancer, for cirrhosis of liver, for non-alcoholic fatty liver. Now the name is changed. It is mesh. Yeah, again, the genetic coding will be feeded, clinical characteristics all will be feeded, and the neural network will be created, and app is ready in the form of AI. So it is containing all the details of the particular disease, whatever. Yeah, the same thing. Blood test will be incorporated, X-ray images, genetic, and AI model is ready, where the algorithm is already you are creating. The creating is the important. But what we doctors mostly after this is keep on increasing. We're just going to use the AI. We are not going to find out how the algorithm is being created. We are just going to use the tool which is going to be given to us. Yeah, using that we can come for diagnosis. We can even use the treatment options, even prognosis. Already the data will be incorporated into it. If this data is there, it is having a good prognosis. If this data is there, he is going to have he or she is going to have a bad prognosis. So already everything is incorporated. We are just going to interrupt that incorporation. Yeah, for example, methotrexate. We all know what drug it is. It is a common drug used for a specific disease. So what happens in case of methotrexate? For example, I'm telling, if I'm not using AI, I just the calendar is given here is he may be allergy for methotrexate. So initially will not tell. After some 6 days, 7 days, or even for that matter, after 6 months, we come to a conclusion that he is completely allergic to methotrexate. He is not susceptible to methotrexate, and we have to replace the tablet. But now what we can do using this AI, yeah, there again neural network. Some AI tool will be there to find out whether the patient is susceptible to the methotrexate drug or not. So using that, I will find out whether he can be given methotrexate or is not susceptible to methotrexate. So I am saving the time here. So daily giving methotrexate and experimenting is no more needed. Straight away go for some other drug rather than methotrexate. So all these are some of the examples of using AI, artificial intelligence. Again, the same thing, finding out the disease, amyotrophic lateral sclerosis. Yeah, all these are apps. Yeah, cardio mobile card, which is recently available, which is used for detecting arrhythmias. That is 24 hours monitoring. So heart rate will be recorded, not the normal heart rate which we record in all our mobiles. Even that is a type of AI. So here you can correctly detect arrhythmias, which I can't keep on be admitted in the hospital for 24 hours to find out arrhythmias. In case after discharge, if I want to check whenever I'm getting arrhythmia, this app can be used. Cardio mobile card, which is one type of AI tool. Yeah, some examples I will tell. Even sepsis. Normally after sepsis only the doctors come to find out that he is suffering from sepsis. Then we go for IV antibiotics, all the severe treatments required for sepsis. But here there are some app or some tool, AI tool, where it detects the sepsis even 6 hours earlier, especially in critical care unit, where we have to prevent the formation of sepsis. Yeah, seizure detecting fits. Seizure epileptic detecting smart bracelets are also now available. Skin checking apps. So some apps which can scan the skin and find out some problems or yes, no problems. Even stroke detection app is there. Ischemic stroke or hemorrhagic stroke, all those things. Breast cancer detection is also there, and drug discovery, just now I told her. Instead of 4 clinical trials has to be done, but because of the advance of AI, that can be done a little bit fast and time saving, and scientists, especially resources, can be saved, and scientists, those who are going to discover the drug, his time also can be saved. All these are upcoming. Yeah, drug discovery, what I told you can see here, just read it out. An advanced machine learning program from DeepMind. It is one of the AI program has revealed, just imagine, 200 million proteins. And those are the 200 million proteins are the pictures that can speed the search for new medicine. As I mentioned, the medicine is always getting advanced. Whatever be the disease, we always find a new medicine. Every year some new medicine comes into the market. That is a separate pharma. And here this DeepMind AI artificial intelligence kit has revealed 200 million proteins, which can speed the research for new. What they are coming to tell is they have developed an AI called Alphabet's DeepMind, which was found to reveal 200 million proteins. So based upon that proteins and genetic coding, they can find out this medicine can be used for this medicine can be. Yeah, a snapshot of every existing protein on earth. Around 200 million of them was captured with this founder, like DeepMind, which stunned the world of science by presenting a snapshot of nearly every existing protein on earth. Like how to create that, maybe that can be explained by our second speaker, like how an AI kit can be created, how an algorithm can be. I was just telling, we are just inputting all these things. Based upon that, we are getting the output, and based upon the output we are getting from the AI tool or AI kit, we are going to interrupt. But what diagnosis is this? Clinical diagnosis is important. This is going to help us. Yeah, obviously manuscript which you are already using. Before and all we used to write, we scribble. Now the latest NMC norms came that we have to write in capital letters or write the drug name in only generic. Now it is approved. We can write the generic, right? Along with that, even the company names you can write, but better to write in the bracket generic name. So this edit my manuscript. Now we take printout. This is also a type of AI, and we update the software. Various softwares are there for doctors in clinical practice. What we do, we just type it, or I will just put M, whatever the drugs available in M will come metformin, methotrexate. If I want metformin, I will click the metformin. Then automatically the dosage will come. So I need not sit and write. Within 1 minute, I can finish my prescription, or for that matter, even manuscript. Yeah, Chat GPT. So prescription writing is also now made very easy because of AI. That software, it is already updated. All the drugs will be incorporated into that software, which will be given by some company people, and they will charge some 18,000 per year. Some may charge 25,000, some may charge 8,000. It varies upon the company. Those company will give the software to us, and already everything will be included. If I am having some stocks, some medicines available in our medical pharmacy, I will just have to upgrade. I will just include whatever medicines available into that, and they will automatically upgrade the software. So I will need not do anything. If I just want to type paracetamol, I will type paracetamol. Whatever paracetamol available, it will come in that software, like Calpol 650, P650, Dolo 650. Based upon that, whichever I want to choose, I will click, and automatically it will be typed. I need not write Calpol 650 111. So like that, the prescription writing also is made easy now. Chat GPT, which almost most of the students will be knowing, and I think you will be using. This is just an example, like how a Chat GPT can be used to create a PowerPoint present. So in Chat GPT, what we do in general, any diagnosis you ask, it will give, like it is like as I ask something, it will give in a typing format. For example, if I want to create a PowerPoint presentation, for example, in emotional intelligence, here a little bit variation. I can't just tell, give me a PowerPoint presentation on emotional intelligence. You will not get the PowerPoint presentation, but you have to use VBA code. It is called a Visual Basic Code. VBA, Visual Basic Code. So the same thing, maybe this can use as an assignment for you. So what I have to tell is, I want you to write me VBA code for a PowerPoint presentation on emotional intelligence. I need 6 slides. Immediately what happens, the Chat GPT will give me this code. This is code of emotional intelligence PowerPoint. This is coding, and I have to interrupt this coding. Then whatever images I want, I can add that. I have to type this VBA code. Then only that VBA code will appear. If I just type, I need a PowerPoint presentation, Chat GPT will reply. PowerPoint presentation directly cannot be presented without VBA. That reply will come. You can check it. So I have to type, I want to get a VBA code for a PowerPoint presentation on homeostasis example. Then what happens? This code, this VBA code will come. Then in that some steps are there, which due to lack of time, I don't want to go in much detail. Then VBA code, some 2-3 steps will be there. Then finally I will get a PowerPoint presentation. I ask 6 slides will come on emotional intelligence. If I ask homeostasis, so this PowerPoint, making it also becomes easy. It reduces the work of the teacher, or it reduces the work of the student. But still, I have to confirm. I have to finalize this PowerPoint. If I want to add something, I can add. I can't just take whatever Chat GPT has given and present it in a forum. That is also not correct. Yeah, all these I explained: ultrasound imaging, CT imaging, MRI, cancer diagnosis. I gave an example: colorectal cancer, all those things. So almost it is going to come into each and every disease. A drug development I discussed, how AI can help in drug development or drug discovery or clinical trials, all those things. The genomics also I explained, gene coding. Yeah, all many things are there. ECG. Yeah, even that arrhythmias I told, some cardio lab, I think KAR, cardio care, I think KARDIO, which is available actually. Your heart rate. Same AI in surgery can help in avoiding some surgery minor errors, because this will be giving input to us. We are already feeding the information to that in the form of algorithm or neural network. You can see AI in surgery. This is without use of AI. Some data may not be there. So some mistakes if you make, if you are going to use the AI tool, it will correct us. Like live streaming vital signs can be done. Lab results can be given then and there. Waveforms ECG can be found out. Image feeding accurate. All those things are there. Yeah, pre-operative phase. personalized risk assessment and optimization, which we do, that can be done by AI kit also, because already that network will be there and it is already feeded. During intraoperative phase, patient-specific resuscitation strategies will be given by AI. Post-operative phase, any complications, even AI kit can detect what complications you could face after post-operative, what treatment for the complications can be needed, all those things. So this is going to help the doctor. I will skip this. AI-based insulin pumps, again a game changer in diabetes. I am running short of time because Gracie wants me to finish by 6:45. Maybe the speaker is waiting, I think. Yeah, type 1 diabetes and all, I don't want to go in much detail. Machine learning, I told it is one of the sub-component of artificial intelligence. Yeah, it is incorporated decision support into many medical specialties. I will just directly go to that kit. Yeah, see here. This is the recent AI kit, automated diabetes kit. So already all the information would have been given into it, and it is like a sensor. So it is going to record. In fact, what it will do, insulin pump, whenever my blood glucose is reduced, that will adjust. I will show in that another diagram. Yeah, artificial intelligence and glycemic control is a separate topic. I can speak that for even 2 hours, like how the glycemic control can be maintained with the help of AI, artificial intelligence. Yeah, digital twin. This is one of the AI where SEER, geolocation, identifies the restaurant and menu with estimated carbs. So if I have this app, like digital twin, whether app or sensor, whatever it is, when I'm going to consume certain amount of rice, it calculates the calorie, how much I'm consuming. Just imagine what this AI is doing. It is like a digital twin. So whatever I'm going to eat, it is going to calculate that you are eating too much calories. It will give, maybe it can even have a sound like effort, like sensor, that I'm crossing my calorie limit per day. For example, if I am obese, if my BMI is more, and I have restricted my calorie to 1200 to 1300 per day. If I'm going to have some rice too much, that calorie also sometimes it is being calculated. So all those are being incorporated in the form of AI. Yeah, see, it deducts meal initiation, duration of meal, how much time you are taking to eat. For example, if you're eating very fast, that time also will be noted. It will be given as a message for you. You have eaten too fast today. All those things. So it is going to extreme that how much time you are eating, what calories you are taking. Maybe it will even have the software of how much carbohydrates you took, how much proteins you took. So all these are helping you like to moderate your intake. Yeah, the Internet of Things, it is called the digital twin, this app. The Internet of Things applied to persons with diabetes using physiological or activity sensors. That's what I was mentioning. Incorporate into smartphones or wearables that associate with the digital twin to provide important behavioral data that can be used to improve glycemia. So based upon that, I can adjust my carbohydrate intake. I can adjust my calorie intake. I can adjust my duration of meal. All those things can be adjusted based upon the information given to me. So I can minimize the burden of diabetes management. Yeah, okay. This I already explained. This again applications of AI in healthcare. Same thing what I told. So almost 120 mind-blowing AI tools are there, like marketing tools. Chat box is where Chat GPT will come. Designing tools are there. Writing tools are there. Video tools are there. Productivity tools are there. So with this, I will conclude my presentation. And obviously, AI cannot replace medical professional. It can aid the medical professional. That's what I want to conclude my presentation. So with this, I will conclude my presentation. Thank you.
Sir, thank you so much, sir. It was a wonderful presentation, and I'm very sure people would have a knowledge about what AI is. And you have also gave outline about not just the medical related stuff, but also the computer science thing. And it is really helpful to correlate both. Thank you very much, sir. And a small announcement to all the physicians right here. We request you to subscribe to Sir's YouTube channel, Dr. Sen Talks and Dr. Sen Physiology, which is done by Sendil Kumar sir, and it would be full of educational videos and a guide to a lot of medical students. Thank you so much, sir. We love your presentation. We would have to have more events with you, sir. Thank you, sir.
Yeah, thank you. Due to lack of time, I was very fast, but okay. Thank you. Thank you for the opportunity, students.
It was great, sir.
Yes,
Thank
sir.
you.
Thank you, sir.
Dear participants, do take 2 to 3 minutes break. So our next session speaker of the day will be joining soon. Thank you.
Hello, guys. Can you hear me?
Yes, sir. So, good evening, sir.
Good evening. Hi.
So good evening.
Good evening. Good evening, Gracie. Good evening, Vishal. Yeah.
So just a small introduction about our special speaker. We would warmly welcome you, sir, Dr. Adrenergix S. Rengan. He is a great surgeon and scientist and a deep tech researcher. He has finished his undergraduate in Keel Park Medical College, masters in Madras Medical College, and a member of Royal College of Surgeons in Edinburgh, and a LGS Fellowship Minimal Access Surgery and GI Oncology in New Delhi. He has a license of a certified acute trauma life support provider issued by the American College of Surgeons. Sir is skilled in applied AI in endoscopy, laparoscopy, abdominal surgery, complex hernia surgery, pediatric surgery, trauma surgery, and surgical education. So we would happily welcome you, sir. You can proceed with your session, sir. Thank you.
Good evening, Gracie. Good evening, Vishal, and the entire team. I'm very honored to be a part of this today. And just a small introduction about myself. I'm a pediatric surgeon, and I'm doing my MCH in pediatric surgery. I'm also the founder of Curium. Curium is a deep tech startup which works on making surgery safer through artificial intelligence. And this is my second startup. My first startup is called SearchTest, which is basically India's largest platform for NEET SS preparation. And I also am faculty at IIT Madras, where I teach deep learning in endoscopy and surgery. So the reason why I started, can I share the screen? Yeah.
Yes, sir.
Oh, yeah. Just a second. Can you see my screen? Yeah.
Yes, sir. Visible.
Uh, is my video visible or is it not visible? It, it's not visible, huh? Just a
No,
second.
the video is not, but the PowerPoint is visible, sir.
Just a second. I will join from another device as well. 1 minute. Okay. Yeah, I think my video is visible right now. Yeah. So one of the key reasons why I started experimenting with AI, especially in the field of surgery, is that I realized that in the field of surgery, objectivity is a major problem. When I mean objectivity, I mean the amount of reproducibility which we bring into our specialty. If a radiologist is able to perform a CT scan, there are other people to review it. If a surgeon is able to, if a physician is able to give a drug, other person can review the prescription and say that this is wrong, this is right, you can do something different. But a proceduralist, a person who is doing an endoscopy, or a person who is doing a surgery, a surgeon, when he is doing a procedure, there is nobody to stop him at the point of time or say that you've done this right, you've done this wrong. So whatever the surgeon says is the final word. Now that's a immense amount of power you are giving. And when I was a resident at MMC a couple of years ago, 5 to 6 years ago, I realized that some surgeons are operating well, some surgeons are not. And I think that is something you would have seen when you are all students, when you're going to the OT. You yourself, you don't need to be a great expert to realize who is good, who is bad. But when someone is operating, that does it look good? Is it completely bloody? How are their hands moving? Are they working with confidence, or are they anxious? So these are all small parameters which you can pick out when you observe a surgeon. And I realized that in surgery there is nothing to measure performance. So my intention was to make surgery safer and to bring in a significant degree of objectivity into surgery. So I started working in surgery, and my area of expertise is computer vision. I'll be talking about computer vision in detail. I'll also be sharing a couple of articles which I've written to simplify AI and how to make life easier for you to understand complex stuff, making it in a very simple manner. And let me tell you, my profile might say I'm a deep tech researcher scientist, but at the end of the day, I'm a surgeon, I'm a doctor. And when I'm talking to you about AI, I'm going to make this as simple as possible in simple language so that you guys as doctors, as physicians, as medical students are able to understand. It doesn't need to be very complex. So today's thing is Nostradamus. So Nostradamus was a 15th century French philosopher, astrologer who made some fantastic predictions. But our field of AI is actually nothing like Nostradamus. This is just a hook to make you listen to me. But so the funda here is that we are able to make predictions. When Nostradamus made predictions, nobody was able to understand why or what is the reason. But here we are able to make predictions. We are able to predict what would be the outcome of this particular surgery, what could be the outcome of this particular treatment. And this is even before the treatment happens. So when you're talking about AI in medicine or surgery, much of the work is actually predictive. That is, if you look at the current volume of study literature which is there in AI medicine, much of the work is predictive. So prediction is literally the biggest boon a surgeon or a physician can have. If you're going to perform a particular intervention, if you're going to perform a particular surgery, what can be the result? Will this patient recover? What will be the complication rate? This helps us have meaningful conversations with the patient and attender. So I'm going to start off with a very early study. This was about 15 years ago. And this was by a guy called Pranav Rajpurkar, and he was at Stanford. And this is the beginning of medical AI, or AI in radiology as well. So what essentially he tried to prove was that about 1 lakh kids in India die of pneumonia. And they die only because there is nobody to diagnose pneumonia at an early stage and give admission and give IV antibiotics and advise admission. So he wanted to make this process easier and faster and more efficient. And in India, the biggest problem was there were not enough qualified and skilled radiologists, especially in rural parts of the country, where you could, get them to look at CT scans. In government service, the amount of radiologists are less. As a specialty, radiologist is a very small specialty. So, and that's why, a lot of medical students want to be radiologists. So what he did was, he fed the algorithm, and I'll tell you what an algorithm is, everything. I'll, explain all the terms for you. And he fed it into a machine, which is basically the convolutional neural network. And he trained it to identify pneumonia. When I mean training, there is a radiologist who is marking, will want to manually, oh, this is a pneumonatic patch, this is a pneumonatic patch. And when that algorithm was trained, after say about 1 lakh X-rays, they measured the F1 scores. F1 score is nothing but a mark of accuracy. So the F1 score for a 95% confidence interval was 0.383 for the radiologist 1. Radiologist 2 was 0.356. 3 was again 0.365. Radiologist 4 was pretty good. It was 0.442. And the radiologist average was 0.387. But the ChexNet, the algorithm, at an average of 0.435. So there's only one radiologist who was better than the algorithm, which actually meant that if there are 100 X-rays, in 80 X-rays, with 100 X-rays with pneumonia, in 80 X-rays, the radiologist is able to identify, but the algorithm is able to identify 90 children with pneumonia. And that, for me, was very phenomenal, because there is absolutely no human who is diagnosing it. But here, lives are being saved just because a computer is able to identify pneumonatic patches on an X-ray. So the outline of the study is going to be, we're going to be talking about radiomics, predictive AI, and generative AI. Each of it I'll be explaining to you in detail. So our computers taking over. The fact is, in many areas of our field, they are taking over. But you have to understand, they're just going to be complementary. It doesn't actually replace a doctor. It just assists a doctor. So let's come to the interesting part. So you guys can mute yourself or put your answers out in the chat. Who's this? Chat is enabled. Guys?
Yes, sir.
Yeah. So, who's this?
Shivaji sir.
Shivaji, yeah. Okay, great. And who's this?
Former Chief Minister Dr. MGR sir.
Okay, then who's this?
Ulaganayan Kamalahasan sir.
Very good. Now, who's this?
Tala Ajit sir.
Very good. Now, who's this?
Talabadi Vijay sir.
So, what is the common thread? What are all of these people?
They are in the film industries.
Yeah, okay. So, who's this? You don't need to name him, but you all, how many of you know who is this? Okay, so who is answering? Who is this?
Karan
Okay.
sir. He's also an actor.
Okay. Who's this? Okay. The fact, and who is this?
But I don't know his name, but he's also an actor.
Great. Okay, fine. And who's this?
He's
Okay.
also an actor, but I don't know his name.
He's also an actor. So the funda is, if I had shown this photo, the first.
Hello, sir.
Hello?
Yes, sir. The old one is Kunal, right? The previous one.
That one is Kunal, Kadalar Dinam, yeah.
Yes, sir.
Yeah. So if I had shown this photo first, 99% of you would not have said that he's an actor. Some of you, when I actually showed this to another group of medical students, when I showed them this image first, they said that he was a cricketer and he plays IPL. So when I said, okay, which team does he play for? Some people said Rajasthan Royals. Some people said, no, sir, he's in RCB and this thing. But the fact is that this guy is also an actor. And the fact that many of you were confidently able to say that he's an actor, because certain neural networks had formed in your brain. So it's easy to identify. You know Shivaji, you know MGR, you know Kamalas, and you know Ajit, you know Vijay. And then this, about 30 to 40% of you know Karan. And then Kunal, the people who had seen the olden days movies in 90s, man, poor guy died of suicide. He died by suicide. But yeah, he had a sad life. But he was a good actor and a very fun-loving guy too. And this is a still from this movie Kadalajanam. And we are able to identify that this guy was also an actor because neural networks in our brain have formed and are able to identify that this is likely to be an actor. Okay, so next this thing. So what is this, guys?
An apple.
An apple. Okay. What is this?
This is also an apple, sir.
Oh, fantastic. This.
This is also an apple.
Okay. And what is this?
And this is also an apple, which is either got
Yeah.
rotten or it eaten.
Okay. This.
Rotten apple. Rotten apple.
Okay. This.
Same thing. Rotten apple.
Okay. This one.
Infected apple, sir.
Infected. Okay. You don't call it an infected. Okay. Whatever it is. This is again another rotten apple. So when we were kids in school, I have a son who is very small and he's in his preschool. And when they teach how an apple is, they say it's a red fruit. It is a very characteristic shape. But when I showed this image to you, the shape was okay, but the color is not red. And this, again, the color is not very similar. And this, the color is okay, but the shape, it isn't half-eaten apple. And these, we have a couple of images of rotten apples over here. But the funda is that you were able to identify an apple, despite the fact that nobody taught you that this is how an apple looks like. And you gained it by experience. You gained it by, being in the world, participating in the world, being a part of society. So when you hear me talk, for some time my video was not on, and at that point of time, you were able to identify that this is Vinayak or this is a male voice talking. Nobody teaches you that this is the frequency of a male voice, this is the frequency of a female voice. Nobody teaches you this is how a child's voice sounds. But this is something which you're able to gain by experience. So when you pick up a phone and you talk to someone, you know that this is a male or a female, or if you're in doubt, you know that you are in doubt about it, or you know that it's a child in most cases. And this is because over the past 20 years or 25 years of your existence, neural networks in your brain have formed, which tell you that this is how things look like. This is why when experienced physicians look at a patient, oh, this looks like pneumonia. Oh no, this patient posted this is abdomen pain is having. It does not look like peritonitis. This looks like pancreatitis. For you, the patient is in crouching position. The patient is holding his tummy. The patient's abdomen is hard, and you know very well that you can't differentiate between peritonitis and pancreatitis by looking. What an experienced surgeon or a physician is able to look at a patient and tell you, no, this looks like pancreatitis. How does he know? If you ask him to explain, he will give you 100 reasons, but all those things may not fit in. It's purely due to experience, and that experience is nothing but, to put it in mathematical terms, the number of connections his brain has formed, neural networks. That is exactly what is happening to him. Okay, so the funda here is that neural networks are formed in the brain. And when you replicate this in computers, this is what is called as a neural network or a convolutional neural network where there are a number of layers. So a simple neural network, there is an input layer and there's an output layer. And there's a hidden layer where the connections are formed. But a complex neural network is something like the image on the right. The amount of connections are huge. So the neural networks learn by interacting with each other on a continuous basis. Okay. So just some basics about, hope you guys are able to follow and understand, and I hope I'm keeping it simple. I would want your continuous feedback through the process. Yes or no? You can put this. I don't see the enthusiasm. When Vijay was there, it was more enthusiastic, I would say. Anyway, so a little bit about, artificial intelligence. Multiple types of artificial intelligence are there, and many of them are related to each other. It's not that they are independent from each other. Some simple terms, NLP, natural language processing, is basically trying to understand how language works. What is the application in medicine? So when a surgeon has performed a laparoscopic cholecystectomy, a gallbladder surgery, and he has injured the common bile duct, or there is a likelihood of this thing, often they don't write it in the notes that they've injured the common bile duct or something like that. What they actually do is they say the callous dissection was difficult, we face difficult anatomy. Neural natural language processing is essentially trying to understand what that person is trying to talk. And this is basically what you see in all your chatbots. When you type something, you don't need to type the exact version, but the chatbot understands what you're trying to type and tries to interpret your language. It tries to interpret your tone. It sometimes even understands sarcasm, and that is something which is pretty amazing. And that is natural language processing. It is basically understanding language as we speak, as we write. Machine learning. Machine learning is just statistics. What is this? Statistics on steroids. In statistics, when you're doing a study, there are about 20 variables, 30 variables. But here, if there is a point of time and there's about 1 lakh variables or 2 lakh variables, you would employ machine learning. A simple example. So you want to understand the cause of an epidemic of cholera in a big city like, say, Coimbatore or Chennai. When you try to plot the factors, when you use statistical methods, if you want to say put 20 factors, you put hygiene, you put water contamination, you are able to get a lot of factors. But at some point of time, after doing that statistical model, you still are not able to pinpoint the cause because there's a lot of factors. Then you realize that there are a lot of factors, like how many people interacted with each other, whether this guy traveled to that place, and suddenly the amount of data appears to be huge. The amount of mathematical data appears to be huge. And that is where you need an advanced form of statistics, and that is machine learning. It's nothing too complex, but that's what it is. Deep learning. Deep learning is a type of statistical tool, but a machine learning tool which is a little more complex, which tries to understand things which are a little more abstract. For example, images. You show it an image. For example, how many people in this room, if you guys are all in the same room, how many of you in the room are wearing a blue shirt? Trying to identify those images, converting them into mathematical points, data points, is deep learning. And this is just one example. It's not just image, but it can be video. It can be a lot of other stuff too. Computer vision is essentially, again, a type of artificial intelligence where you look at images or you look at visual data. So when you're looking at, say, driverless cars, if you're looking at, say, facial recognition, which you see in Facebook, if you look at a lot of the technologies, AI in radiology, it is basically computer vision. Generative AI, now it has become very popular. Generative AI was the most abstract thing before, but generative AI has become the most popular thing since ChatGPT, DALI. I am sure a lot of you guys are using ChatGPT already in your regular hospital work. So that was an image of a convolutional neural network. Now let's talk a little bit about radiomics. Radiomics is essentially extracting a large number of features from medical images using data characterization algorithms. It looks at what is often not visible to the human eye. So some of you might have dogs at home. A dog is able to hear frequencies which a human ear cannot hear. When an earthquake is coming, it can detect the shaking of the ground a little earlier than what a human can, which means that the dog is able to identify, hear sounds which a human can never listen. Similarly, computer vision is able to look into things which a human can never visualize. So what are the things? In MRI, you can use it to identify the tumor shape. You can identify whether the tumor is growing or not. You can identify subtle differences in Hounsfield units. The liver and spleen, when you look on a CT scan, they look same. But minor differences in Hounsfield units, unless you have a computer to identify, it's very difficult. Or these subtle differences is something which computer vision can identify. So computer vision and radiomics involves a lot of features, a lot of these things. It's a little too complex to explain it over here. But the idea is that you will have to feed the computer algorithms a huge amount of data, basically images, and someone has to manually mark those images and teach how to go about doing it. And then the algorithm is able to identify a lot of stuff. So basically this is a abdomen CT scan. And in this abdomen CT scan, it appears to be essentially normal. But if you kind of look at it, there is a abnormality over here. What is the abnormality? Does anyone know or can find out what is abnormal over here in this particular CT scan? Can anyone tell me? I'm sure. Okay, it's not that easy. So this patient has undergone a surgery. That's a clue. An abdominal surgery. Now, can you guys tell me what you can see? So what you see over here is a mesh for a hernia. It's a simple onlay mesh, which is one of the most commonly performed surgeries. Okay. The idea is that this particular lead line was not just a line which was drawn by a doctor, but this was a line which was detected by our algorithms, which my team has developed back in our labs to identify meshes in CT scans. And we did a lot of work in hernia radiology. So we were able to identify a mesh over here. If you can see, there's a mesh, and that mesh is kind of visible over here as well. Now, this is pretty interesting because about 8 out of 10 radiologists were not able to identify this mesh. So how did we do this? We took a lot of CT scans. We took CT scans with mesh. We annotated them manually. Annotation was done, and it was fed into an algorithm. And we were able to, feed it into our convolutional neural network. So I'm not going to get into the technical details of it, but the fact is that we were able to identify meshes in a numerous amount of CT scans. So the tile on the left is the mesh drawn by the radiologist, which is a true label. And the tile which is on the right is the mesh drawn by the computer. And if you look at it, it is reasonably accurate, which means that the computer is able to perform at a good amount of accuracy. We were able to achieve an accuracy of around 70% when it comes to identifying the meshes. We were also able to identify the sac, the hernia sac, as you can see over here in the CT scan, and the defect. Now, this is a ventral hernia. And in the sac, we were able to calculate the volume of the sac as well. If you look at, again, the tile on the left is done by the radiologist. Tile on the right has been done by the computer. So this is all original work which has been made and presented by my team. So we were able to identify the rectus muscles. We were able to identify the flank muscles. We were able to identify the paraspinal muscles, identify the defect, identify the volume of the abdominal cavity and the sac volume. Because when you're performing a complex ventral hernia surgery, the ratio of the abdomen sac to the abdomen volume is pretty important. So this is all due to a patented algorithm which kind of utilized a convolutional neural network and a visual transformer. Again, I'm not going to go into the details. But this is a paper by a very fantastic team from the US, Dr. Todd Henniford's team and Salia Yuso's team, which has been able to predict using the CT scans what would be the risk of wound infection, what would be the risk of pulmonary complication, what would need for component separation. Component separation is essentially a complex set of surgeries to help you close the hernia better. But what this tells you, without getting into too much specifics, is that even before the surgery happens, just by looking at a CT scan, the surgeon is able to have a conversation with the patient and attender. Look, brother, these are the complications which are likely to happen. Just because you read in the newspaper or in your Google that there's a 5% risk of wound infection, it does not mean that you will have that. Your risk of wound infection is much higher because you are your CT scan tells us that you're smoking, you are a smoker and you are a diabetic. Using all this patient data, we can also predict, give you even better prediction. Your risk of wound infection is 40%, which means now you decide whether you want to undergo the surgery or not, or whether you want to optimize. You want to stop smoking for a while, you want to control your diabetes, and then we can operate. Or you can also tell the patient, I'm not willing to operate on you right now because your complication rates are going to be higher. Instead of facing the complications later on and regretting, oh, what could I have done better? We are going one step before and knowing that this is going to happen. So we are not going to do your surgery right now. Or this is not going to happen because your risk of complications is less than 1%. The average is 10%, but your risk is less than 1%, so we can safely go ahead with surgery. So this is how the field of medicine and surgery has evolved, and I think that is wonderful. This is like that film Minority Report. If you have seen the movie, they are able to predict crimes before it happens. And for me, every complication is a crime because we have to try our best to identify it. The average Indian attitude, the fatal karma attitude is that, yes, it doesn't work that way. If you are a doctor, if you are a scientist, you have to work every single day to give the best outcome for your patients. And let me tell you, medicine, surgery, it's all about outcomes. Your skill, great. I know the value of skill because I'm a surgeon. I respect my own skills quite a bit. But at the end of the day, your skills are useless if you cannot give your patient good outcomes, and if you are unable to have meaningful conversations about their own complications. So we are able to do a little bit of work in sarcopenia. I want all of you guys to read about sarcopenia. Sarcopenia is essentially the next biggest thing in the world these days. It's about how fit a patient is for surgery or not. It basically tells you the core muscle strength, the core abdomen strength of a person. So if you're going to undergo an abdomen surgery, or if you want to undergo a major cancer surgery, or when there's a choice, a 70-year-old person is there, whether he wants to undergo surgery or whether he wants to undergo palliative chemoradiotherapy, that could be determined by sarcopenia. And we have also detected and created an algorithm to identify and calculate sarcopenia scores within 0.25 seconds, which a radiologist will take 10 to 15 minutes to calculate using the psoas muscle area, psoas muscle Hounsfield units. So to put it in simple words, when an abdomen CT scan is done, the radiologist identifies the L3 level, identifies the psoas muscle, using certain complex tools on his laptop or the desktop. He calculates what is the average Hounsfield unit density of that muscle and at that slice, and creates a score called HUAC, which is basically an index of sarcopenia. What our algorithm does is, once you put a CT scan, it automatically identifies which is the L3 level. It identifies the psoas. It does all those calculations on its own. And within about 0.25 seconds, we are able to identify the psoas muscle and also give you the score. So if you look at this, you can see the radiologist is able to identify the psoas muscle. The computer is also able to identify it in a very accurate manner. And this is something which I'm very proud of. We are not showed this in many places yet, but we are one of the very few teams in the whole world who are working on AI in surgery. We are able to identify structures. We are able to identify, in certain surgeries, safe zones, no-go zones as well. So AI, I would say it's not artificial intelligence. It's end of the day, it's augmenting intelligence. And ChatGPT has taken over on a massive scale. So I think ChatGPT is something you guys should start learning. And this is an image which is basically a Dr. Mouse dressed in scrubs. And this was an image which was created using artificial intelligence. And I was able to even specify what type of colors I want in it. And that's, I think, amazing. This is a painting of a surgeon as created by Picasso. And this was also created by AI. So I think this was also a paper which I had published. It was a case report, simple case report. This was also part of a challenge where we were asked to use ChatGPT in the publication, and we had also shown how we had used ChatGPT in the publication. So you guys can take a screenshot and actually have a look at how it works as well. So pretty interesting stuff, and I would say this is the future at the end of the day. And I'm absolutely delighted to work with you. So finishing off a quote by Henry Ford. If I had asked people what they wanted, they would have said faster horses. Henry Ford would not have made cars if he had wanted people. If he had agreed to what people said and they said wanted faster horses. Thank you so much, guys. I think it was a pleasure interacting with you. If you have any doubts, I'm more than willing to answer.
Thank you so much, sir.
Hey,
now the floor is open for discussion. If you guys have any doubts, you can put in the chat box.
No doubt. When there are no doubts, there are only two possibilities. Either I have been extremely good at making myself very clear in making you understand the topic, or I have absolutely failed at my objective and made it impossible for you guys to understand. So there are only either of these two possibilities. I'm okay with both of them, but yeah, I would prefer to have some questions from you guys. Hey, thank you, Aditya. So Hari has asked me how to do standardization for AI. See, I don't exactly understand what you mean by standardization, but for example, in the work which my lab is doing, so there is something called as a ground truth. Ground truth is basically an expert radiologist. So if you had seen those images of that psoas muscle which has been done by the radiologist, now that's a ground truth. And we have two radiologists who kind of keep going and adjusting it till the ground truth is clear. And then we plot a graph where we measure the output of the computer and the output of the radiologist, and that is called as a dice coefficient or an intersection over union. Basically, what it tells you is that if two circles are overlapping, how much of an overlap is there? And if the overlap is 90%, we say that the accuracy is around 90%. So this is basically what we do in computer vision, which is my area of expertise. But yes, in machine learning, there are again different strategies. But this is what we do in computer vision, where we identify the IOU, which is intersection over union. It is basically, you draw one thing and you draw another thing. How much of it is overlap? How much of it is matches with the other thing? Is the accuracy. And if the accuracy is usually greater than, say, 85 to 90%, you can say that it's a pretty standardized algorithm. Yeah. Yes, guys. Anything?
Any more questions? Okay, sir. So I think there are no questions.
Pleasure interacting with you guys.
So thank you so much, sir. It was really interesting. I'm pretty sure it was very helpful, from the neural network to the deep learning regarding sarcopenia and also ChatGPT. Thank you so much, sir, for joining us today. It was a really helpful session.
Okay, I think there's only one more question. I would say.
Yes, for sure, sir.
She has asked, how long do you think AI would take to come to regular practice in India? See, I would say that AI is already in active use. So the sarcopenia algorithm which you saw is already been adopted by a center in India. And over the next 1 week, we will have patients getting those reports. We have brain bleed algorithms. So when about 20 CT scans are being done, if one patient, most of it is normal, but if one patient is having a EDH or an SDH, the algorithm detects that there is a brain bleed and sends it to the radiologist so that he can report it first. And is already there in India in many scales. Intraoperative AI, it's not present anywhere in the world, so it's going to take some time. Unfortunately, most of the work in AI is done in the West. US, Israel are leading the pack. We have very good companies in India, Cure.ai, in radiology especially, Carpel, who are doing some good work in AI in radiology. We also are in radiology, but most of our work is in surgery. But and these algorithms are much more affordable. So the idea is to make the algorithms as affordable as possible, because the cost of developing it is pretty high. Because the amount of doctors you need to create the ground truth, initial one, the amount of engineers you require, the amount of supercomputers power you require to train these algorithms is pretty huge. So ultimately, if you want to bring them to the government hospitals, to the public, you will have to make it affordable. You will have to have proper partnerships with hospitals, data sharing partnerships. And in fact, one of the big struggles which we face is partnerships. Even today, senior doctors, the government bureaucrats are so untrusting of newer technologies that they don't want to share information, without realizing the fact that, if they are able to share information, they will be able to get many of these technologies very affordable or at a free cost. So that, I think attitudes have to change, but it is changing for sure. Whether the output from AI is 100% trustable, see, ultimately, just like a radiologist or a surgeon, it's not 100% trustable. So each of these algorithms goes through multiple phases of validation. If you look at any algorithm, there are 3 phases. One is called the test training, which is where you create it. Second is validation. During the process of training itself, we are testing whether it is working, whether it is learning or not. And the final process is called testing, where we actually test it and see if it works. And then there's the independent testing. We give it off to some other random people and ask radiologists to check whether our output is accurate. And after that, we need to go, before it comes to the market or before it comes to the actual patient use, it goes through regulatory approvals. In India, we have CDSO. In US, we have FDA. You have heard of FDA approval. In US, we have Europe, we have CE. So they also do their own independent testing. And this process is a pretty 2 to 3 year long process. And when that is there, you start using it. So is it 100% trustable? Nothing. Nobody can give out to that. But is it as good as a doctor? Yes. In many cases, it is better than a doctor in certain areas. So especially when there's a skill gap. Say a radiologist is not doing hernias on a regular basis, but the ground truth has been created by the radiologist who sees 10 hernias a week, CT scans. So when a radiologist who does only one hernia CT scan a month is able to use his algorithm, he's able to supplement it. Ultimately, the report is going to be signed by the radiologist. Ultimately, the surgery is going to be performed by the surgeon. He has to take a decision. Oh, okay, now this looks correct. So will I follow it or not? So the ultimate discretion is the physician. Yes. Hey, thank you guys. I think it was a pleasure interacting with you. Good luck.
Thank you so much, sir.
Thank you so much to all the participants that are here today. And your presence demonstrates your dedication to continuous growth and improvement. Thank you so much.